Good evening, everybody. This is Jimiesha Thomas, and this is my evidence-based program presentation. My presentation is on dialectical behavior therapy, also known as DBT. I ask you guys to please bear with me. I'm getting over a cold, so I'm kind of sniffling, and I'm a little hoarse, so just bear with me and ignore the sniffling you might hear in the background. So, an introduction again, it's dialectical behavior therapy program, also known as DBT. It's conducted in my area at Crozier Community Hospital here in Chester, Pennsylvania. I chose this program as I used to work there upon graduating with my bachelor's. A lot of the older children within family services that I work with were a part of this program. It's actually a specialized part of a larger program, and the larger program consists of child and family services, adult services, and that includes medical management and case management, and it's also a trauma specific program. So goals and mission. The mission of DBT is that it helps people to move forward toward having a life that feels more meaningful and worth living. DBT targets the issues that cause the stress and teaches skills to deal with them without resort to self-defeating behaviors. Those who come in for an intake on the ground floor at community hospital, they go through intake by a psychiatrist, and if different feelings come up, certain things like low self-esteem, interpersonal problems, or fear of abandonment, they're probably going to be referred for DBT. The main goal of DBT program is to help teens and adults again address emotional distress, develop coping skills, and learn resolving issues without the use of self-harm or drugs, and transforming destructive behaviors into positive outcomes. DBT works on a meso and a micro level, as DBT aims to help individuals in small to medium groups, which include presentations at schools and local organizations. So Program Works treats and serves individuals and groups within the Delaware County community. I'm sure there are a lot of places in this area that do DBT, but this is done in my area at Community Hospital. Staff members who run DBT must be fluent in Spanish, as there's a large Hispanic population that is served in the program as well. Of course, there's an age restriction, as you must be 16 or older to participate within the program. The concept and the information disclosed is for the older populations. Cultural specifics include the fact that facilitators must again be fluent in Spanish, have knowledge of the Hispanic population, and facilitators must be cultural competent and have the ability to work appropriately with all populations, races, ethnicities, and sexes. And facilitators actually receive cultural training before being able to actually run a DBT group. So the program was created by Marsha N. Linehan in the late 1980s and is actually a branch of cognitive behavior therapy. It was started to help individuals deal with borderline personality disorder. Marsha was actually a psychology researcher at the University of Washington. Again, it was started in the late 1980s, but it was used within Crozier community since 2002 is when they adopted the DBT program. Marsha wrote out a guideline to conduction of DBT therapy, but at Community Hospital, it has been modified in a way to fit its specific population, as they not only serve those with borderline personality disorder, but also those with SI, which is suicidal ideation, depression, and they also treat it for those with eating disorders. Program components. So DBT treatment involves individual therapy, skills training, group, and phone coaching calls in between sessions. There are 4 modules of DBT, which include mindfulness, interpersonal effectiveness, distress tolerance, and emotion regulation. Key services include assistance with elimination of self-defeating behaviors, addressing of DP, expressions of thoughts and feelings in an appropriate manner. One must commit to 2.5 hours a week of DBT and a once a week 45-minute session in order for the program to be helpful and to be successful in the program. Universal trauma screening. Again, I'm unsure if the program does universal trauma screening, but again, I do know that upon intake at the hospital, you're asked, like, again, a different amount of questions, and upon answering those questions, you're referred to DBT. But you can also choose, however, not to participate in DBT and just get one-on-one trauma therapy. Let's talk trauma. Trauma Treats trauma formed with childhood and adolescent situations, sexual, emotional, and physical abuse trauma. So that's how the trauma-specific treatment, again, treats childhood and adolescent situations, sexual, emotional, and physical abuse trauma. Framework that helps us understand that we are doing the best we can, even though we need to learn ways of working better. So that's like the framework and trying to figure out, does this actually really work? The American Psychological Association and the American Psychiatric Association consider DBT to be the first choice treatment for BPD. Clients that receive DBT reported significantly few self-injury behaviors and were less likely to be hospitalized. It's, again, individual and group therapy, 2.5 hours of group, and 45-minute individual, and you have to commit to going twice a week throughout 1 year, and each individual is given a binder that contains the information taught in weekly homework assignments. So that's how the progress of this program is actually being tracked. I know that they do a survey at the beginning and a survey at the end of the 1 year mark of the person being in DBT to kind of scale where they are within the program. Maureen Ryan, she's a licensed clinical master's of social worker at Community Hospital in Laura Mancini. She's a LSW. They are the ones who run DBT. They have been running DBT for the last 10, 12 years. I'm not sure who was before them, but being able to work at Community Hospital, I worked under Maureen and worked under Lauren, and I learned a lot of information about DBT through them. So their training includes them having to go through DBT trainings, cultural competence trainings, and they are seen weekly by their supervisor to make sure that they're actually effectively, running this program. What's the price? So DBT members must have adequate insurance. Around this area, it's a lot of Medicaid and Medicare that is being used. Main one is actually called Keystone First, which is state insurance. Crozier Community is a for-profit organization, so if you do not have insurance, unfortunately, they will not allow you to be a part of the DBT program at Community Hospital. Resources collected during intake process into the program and is checked every 6 months. So upon your intake, they take your medical information and they, put it in the system. Everybody gets a chart, and then every 6 months they check to make sure that your medical information is up to date, which allows for you to continue to be in the program. With Crozier Community being a for-profit organization, it means that they bill for everything that they do. So sadly, if they cannot bill for saying you are helping you, they're not going to, see or help you. So strengths and limitations, the program differences. It aims to assist a certain population, but due to approach of therapy, there was able to expand the population. DBT allows for individuals to practice and learn skills alongside others. Members of the group are encouraged to share their experiences and provide mutual support. Program limitations is that teens and adults will benefit from this program. Children under the age of 16 will not benefit. Limitations of this program also include court order attendance. So some of the individuals that actually come to DBT are court ordered, and it's a part of their treatment program because they might have been in the drug and alcohol section of Community Hospital and were referred over to DBT, which I guess the judge feels as though DBT will help them along in their drug and alcohol program. Conclusions. Thank you for staying along with me this long. DBT is influenced by the philosophical perspective of dialectics, balancing opposites. Experience extremely intense negative emotions that are difficult to manage. So that's, really what DBT helps you do, and includes BPD, depression, and eating disorder. Again, if I didn't mention that. And your contact would be able to get involved in DBT is the Behavioral Health Services at Community Hospital, 2600 West 9th Street in Chester, PA. The phone number is listed below. Maureen said that I could add in her email if I wanted to, but I figured if anybody wants to know, you guys could, put it in a discussion board and say, hey, Jimiesha, I want to know more, and I can give you guys Maureen's email. I'm hopefully going to do some emailing back and forth with her about this program, and I'll be able to give you guys some more information in the extra credit box. So those are my 2 references that I used, and I just want to thank you guys for following along, and I hope you guys enjoy my presentation about DBT. Thanks.